ਮੇਰੇ ਨਾਲ ਸਾਥ ਦੇਣਗੇ ਲਿਜ਼ ਹੈਰਿਸ ਜਿਹੜੇ ਕਿ ਐਗਜ਼ੀਕਟਿਵ ਡਾਇਰੈਕਟਰ ਹਨ ਫਰੇਜ਼ਰ ਵੈਲੀ ਹੈਲਥ ਕੇਅਰ ਫਾਊਂਡੇਸ਼ਨ ਦੇ। ਇਸ ਸੰਸਥਾ ਵੱਲੋਂ ਫੰਡ ਰੇਜ਼ਿੰਗ ਕੀਤੀ ਜਾਂਦੀ ਹੈ ਬਹੁਤ ਸਾਰੇ ਹਸਪਤਾਲਾਂ ਲਈ ਅਤੇ ਕੀ ਇਹਨਾਂ ਦੇ ਫਰਦਰ ਪਲਾਨਸ ਨੇ, ਕੀ ਕੁਝ ਇਹ ਕਰਨਾ ਚਾਹੁੰਦੇ ਨੇ ਤੇ ਕਮਿਊਨਿਟੀ ਦੀ ਇਨਵੋਲਵਮੈਂਟ ਕਿਉਂ ਇਹ ਚਾਹੁੰਦੇ ਨੇ, ਆਓ ਇਸ ਬਾਰੇ ਗੱਲਬਾਤ ਕਰਦੇ ਹਾਂ ਲਿਜ਼ ਹੈਰਿਸ ਨਾਲ। Welcome to the program.
Thank you for having me.
Thank you. So you have been the executive director of this foundation. What is the basic purpose of this foundation?
So our basic function is to raise funds and support the local hospitals and the community. So we raise funds for the Abbotsford Regional Hospital, the Mission Memorial Hospital, Chilliwack General Hospital, and then Fraser Canyon Hospital within the community of Hope.
Okay. So this foundation, basic purpose, as you said, is doing fundraising. So what kind of measures do you take to do fundraising?
So we work with the employees within the hospital and choose special projects and look at major needs that are needed at the hospital.
Okay.
So for right now in Abbotsford, we are looking to replace an ultrasound machine up in the medical imaging department. So.
Right.
It's much needed, and as you know, equipment kind of gets a little bit older, like when you buy your car in 2010 and now it's 2016.
Right.
You know, it's not completely up to being the top in technology, and so right now this piece of equipment needs to be upgraded so we can provide the best possible care.
So let's how do you prioritize, because there are so many things which need to be done, so how do the priorities are kept into consideration, and from whom do you take the advice that this is what needs to be done first and then further on?
Yeah, so we work with the executive director at each site, and so we have a meeting with them once a year, and we talk about what the top priorities are, and then we choose the item that we feel is the most important to raise funds for and what the community wants. And then we also work with individuals on the side who want to fundraise or support a certain project in the hospital because they receive care within that department.
Right. Demographics are changing at a fast pace, and especially in the Fraser Valley now we find a lot of Indo-Canadian South Asians who are living, especially Abbotsford area and then Mission and all that. Of course, the complications which the South Asians have as compared to the mainstream are different. For example, heart attacks are the highest, cholesterol level, diabetes and all that. So when someone comes to the hospital, because as I said, the demographics are changing, is it kept into mind that the cultural sensitivity is kept into mind when giving the patient the kind of treatment they want, the language requirements? Is this looked into?
Fraser Health and the hospital, they try to provide the best possible care, and they try to make sure that every ethnicity and every culture is approached properly and respectively. And if they are able to, they do have the resources to bring in a translator to provide that communication. More and more resources are also coming. We, the foundation, are providing education events, and so we have an education event coming up July 14th to talk about some equipment that we're going to buy, and we actually took that poster and had it translated into Punjabi to share it with the community so they know and that they are invited to come and be a part of the event.
Okay. And as we found that in Surrey, the people have been very magnanimous and given big donations to Surrey Memorial Hospital also. Now, when it comes to donations, generally, many times people say that this is the work of the government, to get a new equipment or adding on a new ward and all that. What do you want to say about that?
We do hear it a lot, and we hear that the government should be providing the care. There's only so many dollars to go around, and our job is to help Fraser Health and the community provide the best possible health care. So we want to enhance things, and if we are able to help purchase some of the equipment, then we can use other funds to purchase the other needs that are within the hospital. The need is just so great that we can't service everything, so we have to work together as a team in order to care for our loved ones.
Since how long has this foundation been in place?
We've been in place since 2000.
So during this period, it's a long period. So what kind of activities have been done so far?
So we have had a number of great projects come in. We had the Little Hearts Gala. They had a third-party fundraiser, and they actually took some of the funds that they raised and they painted the X-ray unit upstairs at the Abbotsford Hospital. So they took a sterile room for the children. So now when they come in for the X-ray, the kids feel like they're in a little submarine, and they can look through the potholes and they can see the fish swim by. And it just makes it a little bit less scary. So we've had those types of projects. go on. Right now we're working with the Lions Club in Chilliwack. They're raising $600,000 to replace all the cataract equipment. And that's a regional program. So we do over 5,000 cataract surgeries a year. Only 2,000 of those people actually live in Chilliwack. So 2,000 are coming from Abbotsford, and they're actually coming from outlying communities as well too. So it's a high volume center. And so they have chosen to replace all of that equipment and are needing some help in raising those funds.
That's wonderful. What are the major challenges which the hospitals are facing these days?
For the hospital and you know, for the foundation, it's just sharing the impact so they know that the support that they're giving to the hospital is actually making a huge difference within their community. The donations that come in and the way that we can purchase equipment is letting them know that they're helping us continue services, or maybe we're even able to help reduce some of the wait lists as well too by helping raise the funds to bring in this new equipment.
So basically now again initiatives are being taken for outreach to different ethnicities and communities, and you're succeeding also. As you said, some events have taken place, but in future what are your plans? Like, this is just one phase, what you're talking to replace one machine, but over the years what are your long-term plans? How do you plan to involve the communities so that in tandem work can be done and something positive can be seen?
Yeah, so right now, just because I have been with the foundation September, we are starting to do the education events. So we have done 2 small education events already. October 1st at the Quality Inn in Abbotsford, we are going to have an all-day education forum. We have 15 docs all lined up to come in and speak. It's free to the public to come, and the way we're wanting to do this is we want to engage community with their docs so they can learn about the services that are happening within their hospital. It also, by connecting the people together, it reduces a bit of anxiety, because when you're like, oh, I got to go in the hospital, I have to have a certain procedure. The unknown's very scary. This helps reduce the scariness. It also creates a connection between the doctors, and it allows them to ask questions that they might not be able to answer. And also, when you sit in your doctor's office, sometimes the doc speaks and it's just wah. Whereas this is a different environment, which makes it a little bit more clear, and you're a little bit more comfortable to ask some questions. So, you know, right now our main focus is to educate the public and create the connection between the hospital and what's going on, and how the hospital is supporting the community.
So basically another feather, I would say, which you're trying to add to your cap is to act as a bridge between the public and the hospital, so that the grievances or the issues can be brought forward and something can be done on that.
So create some more understanding.
Wonderful. That's great. Towards the end, if somebody wants more information, is there any website or any phone number where people can contact you?
Yeah, so you can go to our website. It's www.fvhcf.ca, or you can just Google Fraser Valley Healthcare Foundation. You can reach us at our toll-free number. It's 1-877-661-0314.
Great, that's wonderful. And before I let you go, I forgot one question. That is, people are very generous. They want to come forward and donate. And especially in Surrey, we find that, you know, or other hospitals also, people who donate, they can get their names and even the wards also after. So is this facility available here also?
Yeah, so when people do make a donation, we will definitely issue them a tax receipt. And then we also do have our donor wall. If they do make a specific gift to a certain area, we can actually discuss if they would like a bench or have a room named after them. So there's many options available on ways that we can recognize people.
It was a pleasure talking to you. Thank you very much and best wishes.
Thank you very much.
Thank you. जो जिसकी गलबात की थी उस विच लिज ने सानू दस्सिया कि यह जो फाउंडेशन है इसका मकसद है जिस तरह हस्पताल एबट्सफोर्ड विच हन मिशन हन या होर थावां ते हन उन्हां वास्ते फंड रेजिंग करनी बिल्कुल एक काम है सरकार दा लेकिन क्योंकि जो असीं देख रहे हैं कि समा बदल रहा है उस विच लोकां दा सहयोग भी बहुत ज़रूरी है अल्टीमेटली लोकां ने ही फैसिलिटीज़ लैणियां ने जिस तरह असीं देखिया कि सरी मैमोरीयल हस्पताल विच भी पंजाबियों ने इंडो कैनेडियंस ने साउथ एशियन भाईचारे ने वध चढ़ के दान दिता ਅਤੇ ਉੱਥੇ ਕਈ ਵਾਰਡ ਜਿਹੜੀਆਂ ਨੇ ਉਹ ਗੁਰੂ ਨਾਨਕ ਦੇਵ ਜੀ ਦੇ ਨਾਂ ਦੇ ਉੱਤੇ ਵੀ ਬਣਿਆ ਜਾਂ ਹੋਰ ਥਾਵਾਂ ਦੇ ਉੱਤੇ ਵੀ ਅਸੀਂ ਦੇਖਦੇ ਹਾਂ ਕਿ ਵੱਧ ਚੜ੍ਹ ਕੇ ਲੋਕ ਅੱਗੇ ਆ ਕੇ ਸਹਾਇਤਾ ਕਰਦੇ ਨੇ ਅਤੇ ਖਾਸ ਤੌਰ ਦੇ ਉੱਤੇ ਅਸੀਂ ਦੇਖ ਰਹੇ ਹਾਂ ਕਿ ਇਹਨਾਂ ਚੀਜ਼ਾਂ ਦੇ ਉੱਤੇ ਕੰਮ ਕਰਨ ਦੀ ਲੋੜ ਹੈ ਜਿੱਥੇ ਬਿਲਕੁਲ ਅਸੀਂ ਗੁਰਦੁਆਰੇ ਮੰਦਰਾਂ 'ਚ ਦਾਨ ਦਿੰਦੇ ਹਾਂ ਬਹੁਤ ਵਧੀਆ ਗੱਲ ਹੈ ਲੇਕਿਨ ਉਸ ਦੇ ਨਾਲ ਨਾਲ ਉਹ ਥਾਵਾਂ ਦੇ ਉੱਤੇ ਜਿਨ੍ਹਾਂ ਦਾ ਅਸੀਂ ਉਪਯੋਗ ਕਰਨਾ ਹੈ ਜਿਨ੍ਹਾਂ ਦੀ ਸਾਨੂੰ ਜ਼ਰੂਰਤ ਪੈਂਦੀ ਹੈ ਉੱਥੇ ਵੀ ਸਾਡਾ ਫਰਜ਼ ਬਣਦਾ ਹੈ ਕਿ ਅਸੀਂ ਐਜ਼ ਕੰਸਰਨਡ ਸਿਟੀਜ਼ਨਸ ਅੱਗੇ ਆ ਕੇ ਜ਼ਰੂਰ ਆਪਣਾ ਸਹਿਯੋਗ ਦਈਏ ਲਿਜ਼ ਨੇ ਦੱਸਿਆ ਕਿ ਪਿਛਲੇ 2000 ਤੋਂ ਇਹ ਫਾਊਂਡੇਸ਼ਨ ਬਣੀ ਸੀ ਤੇ ਸਤੰਬਰ ਤੋਂ ਇੱਥੇ ਐਜ਼ ਐਗਜ਼ੀਕਿਊਟਿਵ ਡਾਇਰੈਕਟਰ ਕੰਮ ਕਰ ਰਹੇ ਨੇ ਇਹਨਾਂ ਦਾ ਮਕਸਦ ਹੈ ਆਊਟਰੀਚ ਕਰਨਾ ਡਿਫਰੈਂਟ ਕਮਿਊਨਿਟੀਜ਼ ਨੂੰ ਤੇ ਇਸ ਵਾਸਤੇ ਬਹੁਤ ਸਾਰੇ ਐਜੂਕੇਸ਼ਨਲ ਪ੍ਰੋਗਰਾਮਸ ਜਿਹੜੇ ਨੇ ਉਹਨਾਂ ਦਾ ਵੀ ਆਯੋਜਨ ਕੀਤਾ ਜਾ ਰਿਹਾ ਹੈ ਇਸ ਵਾਸਤੇ ਕੋਈ ਵੀ ਇਨਫੋਰਮੇਸ਼ਨ ਲੈਣੀ ਹੋਏ ਤਾਂ ਸਕਰੀਨ ਤੇ ਦਿੱਤੀ ਹੋਈ ਵੈਬਸਾਈਟ ਤੇ ਤੁਸੀਂ ਜਾ ਸਕਦੇ ਹੋ। ਤੇ ਇਹਨਾਂ ਨੇ ਕਿਹਾ ਕਿ ਅਸੀਂ ਐਜ਼ ਬ੍ਰਿਜ ਕੰਮ ਕਰਨਾ ਚਾਹੁੰਦੇ ਹਾਂ। ਜੇਕਰ ਤੁਹਾਨੂੰ ਵੀ ਕੋਈ ਇਸ਼ੂਜ਼ ਨੇ, ਕੋਈ ਤੁਸੀਂ ਗੱਲਬਾਤ ਕਰਨਾ ਚਾਹੁੰਦੇ ਹੋ, ਦੱਸਣਾ ਚਾਹੁੰਦੇ ਹੋ ਅਥਾਰਟੀਜ਼ ਨੂੰ, ਤਾਂ ਇਹਨਾਂ ਨਾਲ ਸੰਪਰਕ ਕਰੋ ਤਾਂ ਕਿ ਉਹ ਇਸ਼ੂਜ਼ ਉੱਤੇ ਕੰਮ ਕੀਤਾ ਜਾ ਸਕੇ ਤੇ ਸਭ ਦੇ ਭਲਾਈ ਵਾਸਤੇ ਕੁਝ ਨਾ ਕੁਝ ਕੀਤਾ ਜਾ ਸਕੇ।